Hi everyone, welcome back to my YouTube channel. Today we are going to talk about dentin. So let's start the topic with introduction as usual. So dentin is a vital component of teeth, forming the bulk of their structure beneath the enamel. It is mineralized tissue that plays a crucial role in supporting enamel and protecting the dental pulp. Now let's talk about definition of dentin. Dentin is the calcified connective tissue that lies between enamel and pulp cavity. It is composed mainly of hydroxyapatite crystals, collagen fibers, and water, making it softer than enamel but harder than bone. Unlike enamel, dentin has microscopic tubules that allow nutrient exchange and sensory transmission. Now let's talk about key characteristics of dentin. Key characteristics of dentin include less mineralization than enamel, tubular structure that enable fluid movement, responsiveness to external stimuli, and they can also regenerate under certain conditions. Now let's talk about composition and structure of dentin. Dentin is composed of inorganic material that is 70% include hydroxyapatite crystals provide hardness. Organic material that is 20% and it includes type 1 collagen and non-collagenous protein that contributes to the flexibility of dentin. And water that is 10% that aids in nutrient transport and hydration. Structurally, dentin contains dentinal tubules which run from the pulp to enamel interface, and these tubules house odontoblastic processes enabling sensory transmission and maintaining dentin vitality. Now let's talk about types of dentin. Dentin is classified based on its formation and function. The types include primary dentin that forms during tooth development and it constitutes the bulk of dentin. It provides structural support. Second type of dentin is secondary dentin that develops after root formation is completed. It slowly accumulates over time and it reduces pulp chamber size as it grows older or with the aging progress. The third type is tertiary dentin that forms in response to injury or stimuli. It is classified into reactionary dentin that is produced by original odontoblasts and reparative dentin that is formed by newly differentiated odontoblasts. Understanding these types help in evaluating how teeth respond to various conditions. Now let's talk about dentinogenesis. The process of dentin formation, known as dentinogenesis, occurs during tooth development. It includes odontoblast differentiation as cells from dental papilla become odontoblasts. Second step includes predentin secretion as the cells that become odontoblasts now secrete unmineralized predentin. And then there is step in dentinogenesis, that is mineralization, that is calcium and phosphate ion deposit to form mature dentin. And at next is the tubule formation as dentinal tubules develop, allowing communication between dentin and pulp. Dentinogenesis ensures the formation of structurally sound teeth capable of resisting mechanical forces. Now let's talk about functions of dentin. Dentin serves multiple important roles that include structural support as it provides rigidity beneath the enamel, shock absorption as it provides enamel for excessive mechanical stress, sensory transmission as it detects stimuli such as heat, cold, and pressure, defensive mechanism as it produces tertiary dentin in response to injury or decay, and its ability to regenerate to some extent distinguish it from enamel which lacks self-repair mechanics. Now let's talk about clinical significance of dentin. Dentin play a significant role in dental health and pathology. First, there are dental caries. If we talk about clinical significance, bacterial invasion lead to dentin degeneration. Caries spread faster in dentin than enamel due to lower mineral content, and there may be dentin hypersensitivity. That is, exposed dentinal tubules cause pain from external stimuli, and it can result from gum recession, tooth wear, or aggressive brushing. Next significance is pulp exposure, that is because of severe trauma or deep caries that may lead to pulp involvement, and it requires curative treatments to prevent infection. Next significance is aging effects as secondary dentin deposition reduce pulp space and changes in dentin permeability alter sensory response. Understanding these aspects aids in effective diagnosis and treatment planning. Now let's talk about the diagnostic method for the dentin. Dentinal health is assessed through various diagnostic tools, and they include clinical examination as it evaluates sensitivity and structural integrity. Second diagnostic method for dentin health is radiographic images as it detects caries progression, and the third is vitality test as it determines pulp health, and the fourth is scanning electron microscopy that provides detailed tubule analysis. These methods help in diagnosing dentine-related conditions and planning appropriate treatments. Now let's talk about therapeutic approach for dentine. Dental treatment focusing on dentine preservation include fluoride application that strengthen dentine against acid attacks, desensitizing agents that block tubules to reduce hypersensitivity, restorative procedures that are filling and crowns to protect damaged dentine, and endodontic therapy that is required in cases of pulp involvement. Maintaining dentinal integrity is essential for overall tooth health. Now let's talk about conclusion of this lecture video. Dentin is crucial tissue that contributes to strength, sensory function, and reparative processes. Its tubular structures make it highly responsive to external stimuli and environmental changes. Understanding dentin composition, formation, and role in dental health aids in proper diagnosis and treatment of conditions affecting the teeth. And this was all about the dentin. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.